Welcome back here to the Mountain Morning Show. Right now, I'm excited to be joined by our good friend Beth Armstrong, the Executive Director of the People's Health Clinic, and she brought some friends with her today as well. I'm excited to introduce you to them. It's Hutt. He's the Administrator of the Park City as well as the Heber Hospital, and Amy Tuddenham. She's the Marketing Director for Intermountain Healthcare. The three of you, how are you doing this morning?
Wonderful. How are you doing?
I'm doing fantastic. Thank you so much for coming on. Obviously, Beth, we love having People's Health Clinic on. We highlight every time exactly what it is that you do for the community. You guys provide a great service to the underserved here in the Park City community, and you also partner with some other great healthcare providers here to really provide the best care possible for everyone here in Park City.
Thank you always. Yeah,
absolutely.
Perfect. And thanks for having us on. It's one of the nicest things that people in town can turn to you, and not just for People's Health Clinic, but for all the nonprofits.
Absolutely.
So, thank you for all.
We love being, absolutely, we love being a host to be able to kind of spread the word about the nonprofits.
Right.
The one thing that's always impressed me about Park City community is how giving this community is and how willing everyone is to lend a helping hand to their neighbor and to really get people back on their feet. So let's talk about the partnership really between Intermountain Healthcare and People's Health Clinic. It seems like you guys really need each other to make sure that the services that you guys are providing are continuing to be provided. So can you speak on that partnership just a little bit?
You bet. I mean, it's critical that patients have access to primary care, that they really have a medical home, a place where they can go. And for a lot of, for pregnant women, that prenatal care is so important. If you have a chronic illness, that preventative care and regular care is so important. And it can really be an access or a barrier to that access if you don't have insurance.
And it's unfortunate that some people, make the conscious sacrifice of, my health is in a bad place, but so are my finances. So unfortunately, I'm going to have to save money and not do what is good for my health. And it's a sad reality and it's a sad choice that many Americans have to face on a daily basis. So the fact that we have the opportunity to provide care to those who maybe do not have the opportunity to provide care for themselves is a great thing. Amy, let's talk about some of the projects that you guys have going on with Intermountain Healthcare in partnership with People's Health Clinic as well. What are we looking forward to?
This past year, we expanded the People's Health Clinic, the women's and newborn services, over to Heber. We found that as a board of People's Health Clinic, there was a lot of patients from Wasatch County that were coming over here for care. And so we felt like the time was right that we expand that clinic into Wasatch County. So we have a clinic 1 day a week, Mondays, where the providers at Heber Valley Hospital provide care for those residents that live in our community. But it's through People's Health Clinic, and then we keep them in their community.
And Beth, what are some of the services offered on that 1 day a week in Heber?
As Amy was saying, this is a women's and children's clinic, so it's mostly currently prenatal care.
Excellent.
And you know that we are providing service for the uninsured. So this is a wonderful place for those mothers who don't have insurance or have access to health care otherwise to get that important prenatal care for the babies, which will always make for better outcomes for the child.
Absolutely. It's always a better outcome, and I think they have numbers and data that show just how much prenatal care and going into a doctor for prenatal care helps with the pregnancy process. Let's talk as well about some of the expansions that are happening to Heber that you guys are making as well. You kind of spoke about the expansion in terms of providing help on a weekly basis. Is there anything else that you guys are expanding to the Heber area besides that?
Just with the growth that we're facing, about 5 years ago, we looked at what was coming, and we needed to kind of revamp Heber Valley Hospital, and we're right in the middle of our $43 million expansion right now.
Wow.
So in June we opened, or in May actually, we opened an Instacare, which we didn't have that extra access.
So
in.
People are really having to come all the way from Wasatch here to the Park City community for that care then?
Yeah, for
previously.
the Instacare, they were having to travel either to Park City or down to Utah County. So we opened an Instacare, and then we also built a new emergency department. We've always had emergency services, but we just realized the volumes we had were more than the current structure of our ER could handle, so we built a new emergency room, and then we brought MRI in-house. So before that, we had a mobile MRI trailer, and then at Park City Hospital, we had in-house MRI, but the volumes between the communities really really indicated that we needed
That you needed two.
in-house units that were available 7 days a week, 24/7.
So is this going to, is with the two kind of being able to open up in Heber as well and provide service to that community, is that going to be able to kind of provide more extensive service and coverage for both Park City and Heber, since the traffic is kind of going to be divided into the two areas?
It really is. We're seeing both communities grow dramatically. We recently added a lot of physician office space at Park City, and we're just about to start that at Heber Valley, and we'll have a significant increase in space as well as hospital
So
services.
that's the next phase of the expansion, which you said begins next week, correct?
It begins about September.
Yeah,
In
it's
September.
mid-September.
So very close here.
Correct.
That's excellent. There's amazing expansions happening. Obviously, we need to continue to expand as our community continues to grow at this kind of exponential rate right now. But it's amazing that we're still able to provide these services to the underserved in our community. I do want to talk about ways that we as community members can give back to People's Health Clinic to ensure that this continues well on into the future. One way that we can do that is by attending a very fun event, and it's definitely the easiest way to give back, I think, is just by going to Healthy Laughs. You guys still have some tickets available for that.
We do. We have about 40 tickets still available. To get those tickets, you can go to peopleshealthclinic.org. There'll be a click on the link to Healthy Laughs, and you can purchase tickets there. You can call us at 435-333-1850. And we'd also like to use that number to call and make appointments for both Heber visits and for Park City visits.
And for Park City as well. Well, thank you, the three of you, so much for coming in. We really appreciate it. On the Intermountain Healthcare side, where can people go to get any information or keep up to date with the expansions that's happening in Heber?
So at Heber, it's heberhospital.org, and then our information for Park City Hospital is at parkcityhospital.org.
Thank you so much, Cy, Amy, and Beth. As always, we appreciate all the work that you do for this community.
Great.
Thank you.
Diego.
Thank you.
Thank you so much. We're going to continue here on the Mountain Morning Show. Don't go anywhere. We'll be right back.